This is the village of Basti Mumdani in the southern part of the Punjab province, the breadbasket of Pakistan. Here and in the nearby Sindh province, the monsoon floods of August and September 2010 had inundated most of the settlements and led to massive damages. This woman lost her house and all belongings due to these floods. She says, "Now I'm living here with all my children and even the animals under a makeshift roof. I even have to cook here, but luckily I have received relief goods from Malteser International." These inhabitants of Basti Mumdani are waiting for a relief goods distribution by Malteser International's team. Most of them have lost all their belongings during the floods. Blankets, jerry cans and soap are necessary to sustain basic hygiene standards and to collect and store safe drinking water, a measure to reduce the risk of waterborne diseases in their temporary shelters. Mohammed El Fat identifies the recipients before the distribution and then assembles them. He checks his recipients list to make sure that all will receive their goods. 41 families will be covered by today's distribution.
Flood came and it destroyed their houses, as you see, and they are very in bad condition, as you see.
The next day, a medical mobile team of Malteser International visits the village Basti Adora. The team consists of a medical doctor, a lady health visitor, a social mobilizer and a dispenser. On their way to Basti Adora, they have to pass a desert-like area. The team is already expected in the village. After leaving their vehicle, the medical doctor proceeds to the male patients waiting for him, while the lady health worker starts addressing the women with health and hygiene messages to prevent infections caused by common diseases. Next to the well and the hand pump is a drainage canal. This had been the point by which the flood waters entered the settlement. This well is also the only one still usable for the affected people. Since the monsoon floods, the others are not working anymore. Like all the other inhabitants, 40-year-old Mohammed Jawid has to fetch water here every day and has to carry it home. His house also collapsed during the floods as well as those of most of his neighbors. But luckily, Malteser International has been able to support him, like many others, in the past 4 months. Currently, his family and him occupy a narrow tent, provided by another organization, with their family of 8. In these circumstances, common diseases can easily be transmitted. And even in Punjab, such a tent does not protect its inhabitants against the current cold winter temperatures. Simultaneously, a second mobile medical team is working in a local school around 80 kilometers away. Here the women patients can be seen consulting the lady health visitor with their health problems. If necessary, the female medical doctor provides them with a prescription for essential medicine, which is handed out in exchange for the paper slip at the temporary pharmacy run by Malteser International. Dr. Ayman Manzoor is one of the few fully trained female medical doctors in this district. She focuses in particular on health prevention issues and pregnant women. Their health status is even worse due to the current severe living conditions after the floods.
As you know that this area is a flood affected area, so we mostly seen the skin irritations like skin diseases like scabies is more common here. And in maternal mortality rate is very high. Maternal mortality rate is very high in the Pakistan, especially in the rural areas, because these women they are attended by untrained but traditional birth attendant with the very unhygienic conditions. They delivered in a very unhygienic condition. So our main concern is to provide them safe delivery, and we are going to launch our project MNCH very soon here in the flood affected areas, and we will provide them safe delivery inshallah at PHUs.
At the schoolyard, the daily routines proceed. The principal makes the students learn texts by heart. The social mobilizer of Malteser International explains their project approach, which is to include the teachers to pass on their health and hygiene messages to the students.
We get the permission from the headmaster, and we went in the classrooms and educate them for personal hygiene. How to wash their hand after toilet, and how to they clean their nails, and how they should be wash their hand before to eat.
Dr. Zahid regularly checks the water purification unit that Malteser International had installed in the village Chak 264 soon after the floods. According to the needs, he maintains the unit and frequently tests the drinking water quality.
Because here it's the water is not fit for drinking, because this water is, they have different type of the chemicals which are hazard for life.
The nearby health center and the neighboring village rely on this source of safe drinking water. More than 1,000 people have to come here every day for their drinking water supplies until new wells and hand pumps are going to be installed this year. In the meantime, all villagers are happy for the support Malteser International provides.